Step 45, embryo transfer procedure. 5 days after the collection, you attend for embryo transfer. I'll explain what happens on the day of embryo transfer and also what difficulties you may face and how your fertility specialist and you will overcome those difficulties if you have difficult transfer. Essentially, embryo transfer takes place in the procedure room, which is adjacent to embryology lab. In the procedure room, you have a gynecological couch and an ultrasound machine and monitor. So your embryo is kept in the incubator in their own individual dish with your name on the dish. Then you attend the clinic with a full bladder. Then you meet these three professionals: your fertility specialist, fertility nurse, then embryologist. They will grade you and then do ID check. Then they will explain your quality of your embryos. Then they will answer all your questions. Then you will stay with a fertility nurse who will help you to prepare for the embryo transfer. Then your fertility specialist will go into the lab and do ID check on your embryo. Every time your embryos are moved, two people need to witness. So this is called double witnessing. This time when embryos being prepared, the embryo identity of the embryo is checked, looking at the dish of embryo kept, which should contain your name, your date of birth, your hospital number. So your fertility specialist confirm that's actually your embryo, and they sign the form and that confirming they have checked together with embryologists. And the same dish in some clinics they display on the monitor so that patients themselves can also check and confirm that's actually the dish containing their own embryo. Then once you're ready for embryo transfer, then fertility specialists will put the speculum in, then do ultrasound scan and visualize your uterus. They find the endometrial lining, then place catheter. Then embryologist brings embryo with any catheter. Already auto catheter is in place. Then any catheter is feed through in auto catheter. Then embryo can be transferred. And some specialists do single stage, which means they bring outer and inner catheter and do one go transfer. That's also fine. There's no difference in the success. So some specialists do two stage, which means they put the outer catheter first, then bring the embryo in inner catheter. Depending on scan image, you should be able to see actual embryo transfer. So to see the embryo transfer on the scan, the catheter and ultrasound beam should be on the same plane. So if the beam and the catheter is not in the same plane, you may not be able to see. But specialists make sure that embryo is inside the uterine cavity and they transfer embryo right in the middle of the uterus. Generally, embryo transfer is very simple, straightforward procedure. Lasts only 5-10 minutes. Actual procedure lasts only 5 to 10 minutes. But in some patients, you may face difficulties depending on these things. You may face difficulties if you had a previous difficult embryo transfer. For that, we need to prepare and find out why you had a difficult transfer, and we need to take measures to reduce the chance of this happening again. Or if you may have a difficulty in embryo transfer if you had a loop excision in the past, because loop excision may cause stenosis of the cervix. Then it may cause difficulty, and there's ways you can overcome this on the day. And you may have actual cervical stenosis, and also you may have anatomic variation. You may have an acute bend in the cervix, especially if you have a cesarean section. You may have a narrowing of the cervix at the level of cesarean section scar. And also you may have something called S-shaped cervix. You may have a double bend. Your cervical canal may go down, then up and down. For that, you need to use a special stellate to overcome that problem. So in terms of planning how to overcome, certainly you need to have a ultrasound guided embryo transfer if you had any difficulties, so that you can visualize the catheter and you can conform the catheter to the anatomy of your cervical canal. And also you can use a valsellum. So cervix doesn't have a nerve endings. You should not feel any pain even if your cervix being pinched and pulled. So you may feel pulling sensation. When you pull the anterior lip, front lip of the cervix, it will straighten the uterus. Then it will be easier to go through go with a catheter through the cervix. Then also you can use a special catheter with a stellate, which is malleable, so you can change the shape of the catheter to conform into the shape of your cervix to make it simpler, easier. And also, generally, embryo transfer is very straightforward procedure. 99% of patients do not need any anesthetic, do not need any sedation. If you had the difficulty with the transfer in the past because of cervical stenosis, because you found it was very painful, very stressful, or if you have severe anxiety, if you have a history of vaginismus, then you may need to have a general anesthetic. You need to discuss with your specialist so that it can be arranged. And the last option is, if you cannot do the transfer, then you need to freeze all the embryos. Then you need to plan to do hysteroscopy procedure to dilate your cervix. Then you can do transfer in the future date. Generally, embryo transfer is a very simple, straightforward procedure. A lot of patients find it very rewarding experience, because coming to the embryo transfer is very important in terms of that you are clearing very critical milestones. You must have cleared important milestones of creation of eggs and sperm, fertilization, embryo development, and you have a high-grade embryo that's suitable for embryo transfer. So that is generally it's very rewarding, and you see yourself, your image of your embryo on the screen. You can take a picture on the day, an image of your embryo, and actual procedure is very straightforward and simple.